Hello, I'm Dr. Marc Rickford. I'm here today to talk to you about the different surgical options that we provide for treatment of morbid obesity here at the University of Maryland, Capital Region Health. Morbid obesity is a condition of excess fat storage. There are many different causes to obesity. One of the things that we'll teach you here at the University of Maryland is not only that surgery is going to be the treatment for it, but also lifestyle changes. So who is a candidate for bariatric surgery? In order to be a candidate for bariatric surgery, you have to have a body mass index greater than 40. Body mass index is how we calculate levels of obesity. A normal weight person has a body mass index ranging from 20 to 25. If you're obese, your body mass index is greater than 30. Severely obese is greater than a body mass index of 40. In general terms, for a female, it's approximately 80 pounds over your ideal body weight, and for a male, approximately 100 pounds over your ideal body weight. On those terms alone, a person would qualify for surgery. You can be smaller than those terms if you have other medical problems related to obesity. For example, if you have high blood pressure, diabetes mellitus, type 2, obstructive sleep apnea, hypercholesterolemia, osteoarthritis. Those are other medical problems which are associated with obesity, which will allow you to also be qualified for surgery. The first few surgeries that we're going to discuss are the laparoscopic Roux-en-Y gastric bypass and the laparoscopic vertical sleeve gastrectomy. I will go through each procedure and explain the benefits and risks involved with each procedure. We'll start with the Roux-en-Y gastric bypass. With the Roux-en-Y gastric bypass, I make your stomach approximately the size of your thumb. The normal capacity of the stomach holds about 1,000 milliliters. After this surgery, by creating the stomach much smaller, it will restrict how much food you're able to eat at one time. The way the stomach works is as food comes into it, it causes your stomach to stretch. When it stretches, you get impulse to your brain that you're full. By making it much smaller, it restricts how much food you're able to eat at one time. That's the first mechanism of action. The second mechanism of action with a gastric bypass is what we call malabsorption. Everything you eat, you do not absorb 100%. This is because we're bypassing the first portion of your stomach as well as a portion of your intestine called the duodenum, where most of your fat absorption occurs. By bypassing that area, everything you eat, particularly fat, is not absorbed 100%. The last mechanism of action is a kind of a internal policeman that prevents you from cheating on your diet. This is called dumping syndrome. What happens is, as those complex fats and sugars enter that portion of the intestine, the body reacts. It causes your stomach to have kind of a pain as well as just discomfort. This will prevent you from eating those foods that cause that. The things that cause that tend to be sweets, complex fats and sugars, foods that patients after surgery should avoid. So with those three mechanisms together, patients usually lose about 65 to 75% of their excess weight in about 12 to 18 months. The major risk involved with the gastric bypass is a leak of the staple line, as well as development of a pulmonary embolism or blood clot. We take great measures to prevent these from occurring during your procedure. We actually give you blood thinners during your surgery to decrease the risk. We also get you up and walking 6 hours after surgery to decrease your risk. One of the reasons we're able to get you up and walking so quickly is because of the technique which we use to do the procedure. We use a technique called laparoscopy, where we make multiple small incisions on your abdomen, inflate your abdomen with the gas, CO2, then do the entire surgery in this fashion. This is a big change compared to an open procedure where they would make a large incision. The big advantage of this is, number one, less pain for the patient. With a small incision, you're actually up and walking 6 hours after surgery. You stay overnight and able to go home the next day. With the open procedure, patients stayed in the hospital numerous days, and a lot of times we're in the intensive care unit post-procedure. This is a great advance in surgery that began in the late 90s, and with this has made bariatric surgery much safer. The other risk and complication is a leak of the connections. So we test these connections in the operating room twice by inflating the stomach with a dye as well as air to look for leaks. We do an additional test the following day to make sure there's no leaks. Once that's fine, patients are able to go home the following day. We also give patients blood thinners on discharge for a few days to decrease your risk of leaks. The greatest thing to help you decrease those risk of leaks, however, is walking. So one of the big advantages of laparoscopy is, again, that you're up and walking. The next procedure that we'll discuss is the laparoscopic vertical sleeve gastrectomy. This is actually the most popular procedure we currently do. This is an example of our stomach. And when we do a vertical sleeve gastrectomy, we make what was previously the entire size of the stomach significantly smaller by using a stapling device to make it smaller. The capacity of the stomach goes from holding approximately 1,000 milliliters to 80 to 100. So with that restriction, of course, you get full much more quickly. Now, the way the stomach works is that as food comes into the stomach, it causes it to stretch. It then goes through the normal digestive process. At the end of the stomach, there's a valve called the pylorus, which opens and closes when your body's ready to digest food, and that's still functional with a sleeve. So with the sleeve, the mechanism of action is restriction. In addition, by removing that greater portion of the stomach, the hormones which normally would stimulate your appetite are also decreased. So patients usually lose about 55 to 65% of their excess weight in about 12 to 18 months. Now, in terms of risk and complications related to the sleeve, patients are at risk for a leak of the staple line, so we take great measures to prevent that by reinforcing the staple line in the surgery. We also test that staple line in surgery to make sure there's no abnormalities of the staple line. We, in addition, do a subsequent leak test the following day to make sure there are no abnormalities. The workup for the surgery is a comprehensive workup. You not only see me as the bariatric surgeon, but you see a whole team of healthcare members. You will see a dietitian who will teach you about, he or she will teach you about nutrition or protein, as well as the dietary changes necessary to be successful after the surgery. Everyone is seen by a cardiologist to make sure their heart is strong enough for surgery, and make sure to decrease any risk for any cardiac events related to the procedure. You'll also be seen by the psychologist who will make sure you understand the surgery and what's required to be successful, and you can make the changes necessary to be successful. All patients who undergo a gastric bypass in the sleeve will also be seen by the gastroenterologist who will take a look on the inside of your stomach to make sure there's no abnormalities prior to us doing surgery on your stomach. For select patients, you may also be required to get a sleep study. Obstructive sleep apnea is a condition whereby when you go to sleep, you go through spells where you stop breathing. Many patients are undiagnosed with this medical disorder. We will do an evaluation in the office when we assess you to see if you are at risk for sleep apnea. When you have sleep apnea, you're not getting good sleep, so you may go to bed early, but when you wake up in the morning, you still feel very tired. So this is something that can be treated prior to surgery, and of course, with weight loss, a lot of these comorbidities will, if not resolve, they will improve significantly so that you may not need as much medication or no medication at all to manage them. People ask, how long will it take to get the surgery? It usually takes about 3 to 6 to 12 months, depending on your insurance policy, in order to get the surgery. You may ask, why do I have to lose weight if I'm going for weight loss surgery? Well, the reason is twofold. Number one, I believe it's difficult for a person to change their habits the day of surgery. You want to start that process in advance. I understand, and I want my patients to all understand, that surgery is just a tool. It is a tool that will help you lose the weight and maintain your weight loss. But ultimately, to be successful long term, I don't mean 1 year or 2 years or even 5 years. I mean 10 and 20 years after surgery, you ultimately have to change habits. We want you to start that process of changing the habits prior to the procedure. It also shows us that you're committed to making these lifestyle changes and that you can be successful. The second reason is from a surgical standpoint. When you lose weight preoperatively, it allows this shrinkage of the liver. One of the things that we will explain to the patients in our consultation is during the surgery, I actually have to elevate the liver and see the entire length of the stomach. If I can't see the entire length of the stomach, I can't do the surgery safely. And if I can't do something safely, I don't do it. So this allows us to do the surgery safely so that you have a good procedure and a healthy and quick recovery. So all these things take a little bit of time. Although it may seem like a burden to wait so long for surgery, I think it's a good thing in order to get the patient in the right frame of mind to undergo the surgery. It's also important that the patient has support of family members. It's a hard process to change all these habits. So with the support of family members, patients can tend to be successful. If you don't have family members to help you, we also offer support groups for our patients so that they can come and get information from both the dietitian, our bariatric coordinator, and some other health professionals, including psychology, who can help you through difficult times after surgery. We want you to understand this is a lifetime commitment. You will follow it with me and our team for the rest of your life after surgery. At least once a year, at minimum, to see me as the surgeon, as well as follow up with our dietitian, as well as our coordinator. The most difficult part of the surgery is not the surgery. I always explain to the patients that's the easy part. The hard part begins when you go home. After surgery, the biggest adjustment is how slowly patients have to eat. I explain to them that you cannot imagine how slow you're going to eat. You're almost like a little bird, taking little sips initially. Initially, after surgery, you're going to be on a liquid diet for a gastric bypass for 2 weeks post-operatively, for a sleeve for 3 weeks on the liquid diet. Once that period is over, you then progress to a parade diet for 1 week and then back up to solid foods. However, when you eat these solid foods now, you're going to be taking very small bites, chewing your food at least 32 times like you did when you were a child, when your parents were telling you not to rush when you're eating. You have to continue those good habits. The important thing is to go slowly, and when you go slowly, what you do is you allow yourself to feel the fullness that you're developing. Because your stomach is going to be either with the gastric bypass the size of your thumb or with the sleeve like a cylinder, it gets full very quickly. So when you are eating, you don't want to eat and watch TV at the same time. You don't want to eat and drink at the same time. All your behaviors will be changed. This is something that the dietitian will go through with you during the preoperative period as well as post-operatively. All patients have to be seen by the dietitian and do a number of classes prior to surgery in order to get this education. And this education is what's going to give you long-term results. An additional thing that I also stress for my patients is the importance of supplemental liquid protein. One thing I believe is if I make your stomach this small, I don't believe at every time you're able to get enough protein just from eating foods. So I have my patients do supplemental liquid protein after surgeries. I like my patients to do a certain amount, at least 80 to 100 grams. And the reason why I do this is twofold. One, I'm assured every day my patient has adequate nutrition. I'm not worried about my patient being sickly or tired. Every day I know they have adequate nutrition. And with that, their weight loss is healthy weight loss. They don't lose hair, they don't lose muscle. Their skin is healthy and shiny, and they have plenty of energy. If you don't do the liquid protein, you can develop some of those problems. Some of the nutritional deficiencies that are sometimes associated with the gastric bypass are, for example, are vitamin B12 deficiencies and iron deficiencies. So all patients after surgery would also have to take supplemental vitamins. Some of these vitamins include multivitamins, vitamin D, vitamin B12, iron, and calcium. These are vitamins which you probably should be taking anyway, but most patients don't take them. We tend to take vitamins when we're young, when our parents force us, and when we're old, when we're worried about other issues. But you will have to take vitamins as well after this procedure. In terms of things that you can and cannot do after the bariatric surgery, one of the things that I stress to my patients is no smoking. If you're a person who smokes, you have to stop smoking prior to the procedure for me to even consider doing surgery. And the reason is twofold. Number one, we're trying to make you a healthier person. The number 1 and number 2 cause of preventable death in the United States is obesity and cigarette smoking. So we're trying to improve those things. So no cigarette smoking. Even after surgery, if you start smoking, it increases your risk for developing ulcers of your staple line, which can lead to perforation or even require emergency surgery to repair. So no cigarette smoking after the procedure. Alcohol is a big question. Although all of my patients are adults, I really don't want them to drink alcohol. Alcohol is a big source of empty calories that patients get after surgery. A lot of times patients are doing very well, they've lost significant weight, they start hanging out and doing things, fun things with their friends, and slowly alcohol becomes can become an issue. One of the problems with alcohol after the surgery is if you drink even a little bit, you may become intoxicated very quickly. So a simple doctor directive, no alcohol after the surgery. Certain medications you cannot take it as well after the surgery, such as non-steroidal anti-inflammatory drugs, otherwise known as Advil, Motrin, things that patients take for joint pain and relief. The reason being is those things can tear up the lining of your stomach and cause a perforation or hole of your stomach. So this is absolutely contraindicated after surgery to take any of those medications. Now, if you do have pain, you can always call me and I can give you something appropriate. But you always have to remember this, when you go to emergency rooms, you cannot take these medications. Pregnancy is another issue after surgery. For many patients, they have had difficulty getting pregnant because of the obesity. However, with weight loss, patients become very fertile. However, I do not want you to get pregnant during the first 12 to 18 months after surgery for two reasons. Number one, that's the period where you may be at high risk for a miscarriage, which can be a very traumatic event. So it might not be the best time to do that. Also, because it's the period of greatest weight loss, this could have a negative effect on your results. In terms of your recovery post-operatively, you're up and walking 6 hours after surgery. The more you walk, the better you feel. After 1 week, you can drive, 2 weeks you can swim, 4 weeks you can lift weights. So at 4 weeks, you can resume all strenuous activity. Some patients may ask, when may I resume sexual activity? I consider 4 weeks would be a more than sufficient time in which you may resume sexual activity. Return to work will depend upon which surgery you have, but in general, most patients are able to return to work within 2 to 4 weeks after surgery. You may be able to return sooner if you're not doing anything strenuous. That is one of the big advantages of laparoscopy, is that you're actually up and walking, so you don't have as much surgical pain. You may have pain which is known as gas pain from the stretching of the stomach, but with walking, that pain is resolved, and as the days go by, there will be less and less gas pain. One thing to understand with this procedure is that the way you eat and drink is changed forever. No longer can you take large bites or large gulps of liquid or large bites of food. You have to take very small bites and truly chew your food. And when you're drinking, you have to sip throughout the day. I always explain to patients after their surgery, a lot of times patients don't realize how they drink their liquids. For example, most people will go all day without drinking. Then they get a large cup and drink it down very quickly. After the surgery, you have to sip your water throughout the day. The reason being is I want my patients to drink at least 80 to 100 ounces of water a day. Most people don't even recognize how much water they drink. So this is a very regimented lifestyle that you're going to be developing after this procedure. One of the big things that occurs after the surgery is almost immediately, for example, with diabetic patients, we stop their oral hyperglycemics as well as their insulin. We will monitor that in the hospital, and a lot of times the patients go home off those medications. Soon thereafter, if they have high blood pressure, we will also decrease their blood pressure medications. The reality is this surgery is not a cosmetic surgery. This is a surgery to improve your health. We know that staying morbidly obese will decrease your lifespan by 10 years. This surgery will actually help to improve your lifespan as well as improve the quality of your life. Weight regain is an issue after the surgery, particularly when you don't follow the instructions in terms of our diet that we recommend for you. A lot of times this happens because initially you're very focused on your procedure. You're listening to what the doctor and the team have told you, and you're following those things to a T. However, life gets in the way. We have kids to deal with, we have jobs, parents, children, all these factors. So it's important that we establish these habits while we're focused on them, and hopefully they will keep going and continuing. Now, if you do have weight regain, of course, you're going to be following up with me, so we'll be monitoring your weight. But in addition, we'll also have the dietitians who you can follow up with to get refresher courses on what you should and shouldn't be doing after surgery. One of the things that patients often are concerned about is as they lose significant weight, they may have loose skin on their arms or on their stomach. Generally, I like to wait at least 1 year after surgery before we refer you to the plastic surgeons. The plastic surgeons would possibly do things such as what they call paniculectomy, which would be removal of the excess skin on your stomach. They also do surgeries on your arms as well as your thighs. Now, most insurance companies may pay for the paniculectomy. However, a lot of insurance companies do not pay for what they consider strictly cosmetic surgery on the arms and the thighs. We have a plastic surgeon who works in our practice who sees many of our patients, but we also have other plastic surgeons in the community that we refer to. I would say that most patients prior to coming to see me have been thinking about weight loss surgery for at least 2 years prior to coming to any evaluation. And that's because this is a huge decision for you as a patient. You understand that you have to make significant lifestyle changes in order for you to have the health as well as the long life that you want. Now, the surgery will help you, and it is a tool, but it does require you to make those changes. All of my patients are committed to those changes. They understand their responsibilities. They know that when they come to see me, the first thing that I will ask them is how much protein are you taking, how often are you exercising, and how much water are you drinking. All of these are standard questions that you, as a patient, are committed to doing and following up with us for the rest of your life. I've done over 2,500 bariatric surgeries throughout my career with excellent results. Excellent results in terms of long-term follow-up and care. The thing I'm most happy and the reason why I do bariatric surgery is that it's one of the most fulfilling surgical disciplines. My patients really appreciate the effect that I've had on their life. So if you're interested in coming to see us for an evaluation for weight loss surgery, we look forward to meeting you. Thank you.